Before my procedure, I struggled with veins that were so bad, my legs cramped. I walked more at night than I slept.
Before my procedure, I struggled with walking and swelling in my ankles and just couldn't walk too far. Because of Dr. Lateef, I'm able to walk a long distance now and able to do things that I wasn't been able to do before.
And after the procedure, I have no problems. It was just great.
Valley Endovascular is a physician-owned medical practice specializing in the diagnosis and treatment of vascular disease. We opened our practice in the Central Valley on April of 2010 and relocated to our current location in the Hanford Medical Pavilion on April of 2011. Valley Endovascular Institute of Surgery diagnoses and treats the full spectrum of vascular disease, from carotid artery disease, abdominal aneurysm, peripheral artery disease, renal artery disease. We also have a dialysis access clinic for patients requiring dialysis access. It also extends services to patients who have cancer and they need chemotherapy access. In addition to that, we also have a limb salvage program, where the main center of it is the combination of vascular surgery and physical therapy for limb salvage, or the prevention of amputation. The fifth one will be the varicose vein clinic.
In the last decade, vascular surgery has undergone a tremendous rebirth and regeneration, and that included a minimally invasive component, which basically includes a puncture in the arteries that allows us to go in endovascularly and do a procedure in the same day by finding blockages and either doing a balloon plasty or opening of those arteries, or by placing a stent in those arteries. So the component of minimally invasive has changed the way we've done vascular surgery from the old traditional, where patients would have to go for a bypass surgery, be in the hospital for perhaps well over 2 weeks. That has changed the paradigm in the way we've handled patients now.
After he did the surgery, I was able to get around and walk. It was done in the office. That day I got out, I came home, cooked dinner, did my chores, never slowed down yet. So it was great.
One of the things with our practice and our practice policy and the way we see things is not the traditional going to a doctor's office, but to create a nice environment where it starts from the front desk. It's not an old-fashioned doctor's office, but it's just an entire open office where they can come in, ask questions, and have a nice, courteous conversation with that staff. And that extends into coming in and seeing our medical assistants when they're getting their history and physical taken, to make the patient feel comfortable and not nervous, because obviously when you come into a surgeon's office, it's not the same as going to your medical doctor. It's very stressful to the patient. They're very nervous, they don't know what to expect, and it's my responsibility, and as well as the staff, to make those patients feel comfortable, and that transcends into the examination room when I interview that patient, all the way through surgery and to the post-op care. And I think that's what adds to the uniqueness of our practice.
Our mission is to improve the quality of lives of patients with vascular disease in the communities we serve. If we can provide them a minimally invasive option to treat their symptoms and bring them back home or keep them home longer, that's improving their quality of life.
That staying close to home is a very, very important component for our patient. And for their family too, because their family doesn't have to take time off from work to travel long distance versus just dropping them off and then picking them up and going back home.
In this economy, when the patients have to take time off from work and their caregiver to take time off from work and go 45 minutes one way and round trip, so they basically took a day off from work already. We also have moms, working moms, and being able to come within their lunch break versus having to wait until the afternoon, get a babysitter to care and pick up their children. So a lot of these things that we don't really consider as immediate quality of life change do have an impact in the patient's well-being.
I was going to Visalia at one time, but it got so bad traveling back and forth in the fog, and my husband is a diabetic, and it was just too hard for him, so I found him and I latched onto him, and I'm keeping him.
Customer service is a very important part of our practice, whether it starts from visiting the website or calling our front desk. One of the unique things about our practice is that even as a surgeon, while I'm operating and a patient is trying to get hold of me or a physician is trying to get hold of us, those phone calls can actually be converted into emails and sent to all our staff members, including the practice administrator. So therefore, none of our consults or phone calls can be missed. The unique part of becoming a vascular endovascular surgeon is it allows us to offer an array of care for our vascular patients versus just being sort of one diagnosis treatment. And we can get our patient in very early, get started with the procedure and be done on a timely basis and still get our patients out in the recovery and on their way home. And so that cuts down tremendous waste of time. And that's, I think, for that patient or for any of our patients, just coming in, get things done, and having on their way out for their recovery really cuts down in a lot of their time.
I would surely recommend Dr. Latif because I believe he's very knowledgeable in what he does. You can't really beat his staff. They're just wonderful people over there.
Dr. Latif is just a very great surgeon and his staff is outstanding. Yes, I would recommend him to anybody, anytime, anywhere. You're at ease. Everything is explained to you beforehand, so you know what you're getting into. And I trust him.